Hi, I'm Judith Heller, and I'm proud to oversee physician recruitment at the Northwell Health System. I'm pleased to partner with our clinical leaders. Now I'd like to share with you their vision for growth.
Welcome to Peconic Bay Medical Center. My name is Amy Loeb. I am the executive director here. As a result of a local farmer having a heart attack and the community coming together 70 years ago to create this hospital, it has become a regional medical center. It's really a wonderful story, and it continues to grow and blossom.
Peconic Bay Medical Center is located in Riverhead, Long Island. Coming out here, my eyes were definitely open to how diverse this community is.
Everyone is connected to this community. You feel like you're part of it immediately.
Since I've been here almost 11 years now, I've seen the changes. I've seen us keeping more of our patients out here.
Northwell has provided a lot of specialists and subspecialists that we wouldn't even know could have been possible. The availability of these subspecialists has been a great advantage, not only to me as a physician, but definitely for the patients in the community.
We found pretty quickly that once we showed we could deliver high quality care to the patients and to the referrals, things started rolling in.
Just being, a young doctor and being part of a place that has so much growth and still has so much more to expand to has been really great at this point.
So what we have in our operating rooms is an outer core and inner core design. So our outer core allows us to have the natural light because this is an independent building, and so that's what comes through into our operating rooms. These ORs were built in 2008, so very new. We are fortunate to have an XI Da Vinci robot here where we perform minimally invasive surgery, and it has been a really wonderful addition. Each of our ORs are equipped with video-assisted technology. We have maintained an extraordinarily low surgical site infection rate, which we're very, very proud of. Then we go through the operating room here, which leads us into the inner core. And each of our 6 current ORs are connected in this way, where we keep our sterile items and where our team gathers. Welcome to Surgical Pavilion, affectionately known here at Peconic Bay as SP1. It is our orthopedic unit, single-bedded rooms, plenty of space for our patients to move around, their loved ones to visit, and of course we have full bathroom, including a shower in each patient's room here. Here is our physical therapy space on the Surgical Pavilion. Here we do our inpatients recovering from joint replacement therapy, spine surgery, and other surgeries. Also here we do cardiac rehab, pulmonary rehab, and we are looking actually to expand our outpatient therapy to include Parkinson's and lymphedema therapy. Welcome to the Corey Critical Care Pavilion. We are a level 3 trauma center. When we began the COVID crisis here at Peconic Bay, we literally had just opened this building, and we were able to care for those patients in our ICU, state-of-the-art, all negative pressure, and we were able to provide care that was truly patient-centered. This is a 60,000 square foot building, which was dedicated just in 2020. Our community stands behind this hospital with regard to philanthropy in a way that I've never seen in my career, and it's really very special. Everyone owns this hospital together. So we are going to walk into one of our 16 state-of-the-art, brand new ICU rooms. As you can see here, very spacious, each with a bathroom. Each room here is equipped with eICU technology, which means that there is a camera in each room connected to a virtual ICU within Northwell. We are able to tap into managing any kind of critical event that comes up 24/7. Each room has a place dedicated for families to be able to stay. Within the last few years, we began staffing with critical care physician's assistants around the clock here in the ICU, as well as surgical physician's assistants.
We can refer patients to almost any specialty at this point because of our connection with system-wide Northwell Health. Whether it's neurosurgery, colorectal, hematology, oncology, cardiothoracics, that allows a lot of access to different specialties that in some other situations and some other systems you may not have access to.
Another great addition is our Manorville Campus, where we have the Grossman Center for Imaging. We have a multi-specialty physician practice office, and we also have primary care and immediate care. In this campus, we see over 35,000 patients every year.
And then you also have your other community physicians that also practice in this Riverhead, as we call the North Fork and the South Fork of Long Island.
I didn't know what Northwell was. I wasn't from Long Island. I realized what a big system it is, how much it has to offer, and working with the other hospitals in the system just gives you so much opportunity.
Welcome to the third floor of the Corey Critical Care Pavilion, which is our Canis Regional Heart Center. This is the home of our brand new state-of-the-art Cath Labs, one of which is also equipped to electrophysiology. We are going to walk into our Cath EP lab. What we have here is the most technologically advanced labs on Long Island. We're going to walk into our second Cath Lab. So this is a Cath Lab alone. Nice to have the redundancy though. So this is our state-of-the-art Cath Lab. It's a Philips lab. We save about 50 to 60 hearts per year, which makes us one of the busiest STEMI receiving centers on Long Island.
We do have a rooftop helipad on the new Corey Critical Care Pavilion, and we can get them to the western part of Long Island in 15 minutes. We can get them to our sister hospital, Southside Hospital, in around 10 minutes. And then we do have ground ambulances.
Here we are in the trauma room of our emergency department. So it has already tripled in size over the last 15 years or so. And now we're looking to add another 20,000 square feet to the department. We see, believe it or not, 38,000 patients every year here in this department. So it's a busy emergency department. We service 400 square miles and 200,000 community members here at this hospital. So this emergency department is very important to this community. Exciting things ahead for this department. One of our big focuses for the future is women's health care. We have onboarded some fantastic physicians specializing in OBGYN, urogynecology, breast surgery, plastic surgery, and urology. One area of opportunity and growth for us is in cancer services. So we now have a robust cancer screening program between lung cancer screening, of course, mammography. So what we have here is our Caregiver Center. This was opened in 2018. It is a source of support for our patients' family members. And so imagine those who are taking care of patients with dementia, chronic and debilitating illness, how difficult it can be to navigate those resources. So we do that for them, and we support them in that through outreach services with social workers and volunteer caregiver coaches, as well as through support groups. We have come tremendously far in terms of patient experience scores here and are now one of the top performing hospitals on Long Island.
Here I realized that there are so many people interested in research. I think clinical research helps move medicine forward. I have a strong interest in it. Peconic really, and the Northwell system was open to finding a place for me in the academic world. What made Peconic different is they never put me in a box or a bubble. They said I could try many different things while I'm here. They encourage that. It offers room for growth, opportunity, and everybody here is always open to exploring those with you.
Thank you for taking the tour of Peconic Bay Medical Center with us today. We can't wait to meet you. And the real question is, are you made for this?